Good morning, everyone. My grateful thanks to the TDU, the Trans-Disciplinary University, Dr. Darshan Shankar, to have invited me today, and also the other supporters for this venture, Jawaharlal Nehru University. I would like to put this, and PFI, of course, I would like to put my talk in an informal way. It isn't a structured talk, but I think it's important that you understand from a person, not because I have all the knowledge, but certainly the experience of watching public health as well as the aspects of medical education in the pure allopathic sphere. And then on first promotion, reaching the Department of Indian Systems of Medicine and Homeopathy, as it was then called, and then suddenly turning the telescope the other way around. And is there anything to gain? Is there any blend at all possible? Is it dangerous? And can COVID-19 and the tremendous upsurge of interest in immunity boosting through Ayush teach any lessons? So I would like to share with you some things from the past, some things from the present. I'm starting at 11:20, and so I expect I have to finish in 20 minutes. So if I'm overstepping, I'll be very grateful if the moderator just gives me a nudge, because I tend to just go on and on, like many speakers do. Now, I think that the fact that we have pluralistic medical pluralism in our country, it is recognized by law. It's recognized under the Drugs and Cosmetics Act. It is recognized by the different the Central Council of Indian Medicine, all that. So the practitioners, in fact, are allowed to do pretty much whatever they like. It's only when you sell drugs that you need licenses. We have in India a complete difference between the best and the worst. So really, when you talk of Ayush, one has to be pretty clear what kind of basket are you dipping into. Second, there is also not just Ayurveda, but there is Unani, there is Siddha, there is the naturopathy, there is Saurikpa of the Amchi medicine of Tibet, which is also recognized under the CCIM Act. And also you have yoga and naturopathy. Now, all these are working in the background, probably benefiting much smaller numbers of people as compared to what the mainstream, let's call the allopathic system, the mainstream, whatever it is able to do. But COVID has brought a certain, you might say, realization, both within the educated and illiterate consumers, who have embraced the need to ward off illness by leading healthy lives. This is the biggest opportunity. Till now, it was pop a pill, get well, go back to work, send the child to school. Sudden realization that you can take care of your health and not have to really succumb to all kinds of seasonal illnesses, as well as the non-communicable diseases like hypertension going on to CVD and going on to diabetes and things, it can be prevented very early on. And my co-panelist is Dr. Srinath Reddy, who kept my mother alive till she was 102 and a half, simply because he did not believe in high-end medication. I remember he came to see my mother as a friend, really. He was an AIMS doctor, a cardiologist, and he wouldn't waste his time normally. But I used to persuade him to come and see my mother. And, you know, he watched my son digging into parathas and chicken, told me very gently, I think you must reduce this. And I realized how early on, at the age of 9 and 10, you could be completely finishing a child's health by doing the wrong things. And I was educated. I was in the health ministry. I should have known better. So I'm only trying to say that we had not really understood the benefits of prevention. And that is where the Ayush system and whatever it has done during the pandemic has really brought into the Indian psyche across the cross-section of society the need for your kadhas, your turmeric, your herbs, your condiments, which are lying in the house. People have taken to organic gardening on their terraces, on their balconies, Because suddenly the feeling is you can get this wretched virus, not necessarily COVID, you can get anything by exposure to things which are not clean and things which you do haphazardly, just eating a kind of diet which is palliative for the moment, but extremely harmful in the future. So with that little background, I do want to get into how do you sustain this interest? How do you keep it alive now that COVID is on the wane? We don't know whether we will have another upsurge if one of the mutations hits us, but let us take an optimistic view. If things go back to normal, how are we going to deal with it? I do feel that one must first understand, is it good to work in silos, or is it good to give the consumer some benefits which he is looking for? Most of my time in Ayush went listening to lobbies. Lobbies is not a bad word. It is something which all of us do. If we have a cause, we will fight for that cause. So you had the drug manufacturers lobby, you had the medical educationists lobby, you had the people who were interested in pursuing research, their lobby. And those lobbies were very friendly with each other, but they never talked about the consumer. And the consumer is the one who has to decide, does he want homeopathy? Does he want Unani? Does he want it to, for what reason does he want to take all this medication or be under the care of an Ayurvedic or Unani physician? Why would he want to dabble in two different sets of medicine? This is where I think the understanding of integration is critical to taking this forward. And integration to different people means really different things. Integration could mean really between practitioners and the acceptance of referrals. Suppose, for a minute's sake, you have a doctor who says, well, all right, I can't do very much for you beyond this for your arthritis, but maybe Ayurveda's Panchakarma could help you. I can write a name and you can go and visit that facility or look for one yourself. But I have heard that Panchakarma does wonders for people with a backache or arthritis. Is there anything wrong with that? But the Indian Medical Association will not accept it. They will get after any doctor who dares to write any such thing. I talked to Philip Hayden of Himalaya Drug Company, one of the biggest companies in the Ayush sector. And he said, isn't it funny that my driver can go and buy Live 52, which is a time-honored tonic for the liver, given to people with jaundice, given to children with low appetite, in, of course, varying quantities. And that Live 52 has been a kind of panacea in the Indian it accounts for the largest share of sales of Ayush medicine. Now, he said, my driver can go and buy it from the chemist, but a doctor cannot write on a prescription Live 52. Now, this is something which is, it is just a dichotomy. How can one overcome this? On the other hand, the allopathic system would say, you are not allowing anyone but a medical practitioner, that is an allopathic medical practitioner, to write a prescription. How dare you dabble in our area, which we are the experts of? So here you have lobbies at play and the consumer being put to a lot of inconvenience, not knowing what he's supposed to do. Then you have integration through co-location. What was tried, what the Vice Chancellor Darshan Shankar just mentioned, which is you put an Ayush doctor along with the normal medical officer in charge of a primary health center. And when I did my reports, I visited a large number of these co-located facilities. And I was very, very upset to see that all that the Ayush doctors were doing was to play second fiddle to do the routine work which the medical officer palmed off to them. And they were quite happy to do it because they suddenly were wearing a white coat with a stethoscope and feeling very important and doing no Ayush at all. The third kind of, you might say, integration can be the integration in terms of allopathic doctors being permitted by law to prescribe Ayush medicine, Panchakarma, and other procedures. That's going very far. And that is the integration which I would have liked to see first through ensuring that the allopathic doctors visit the facilities and see for themselves, is there anything to be had through these systems? Why do you say that they are all, hocus pocus, till you have seen it? I went as a blue-blooded bureaucrat from the Ministry of Health after years of having worked in health ministry, and before that, health secretary in a state government and then in Delhi government. And so when I was promoted, frankly, I had this attitude of, imagine they're wasting me with all my knowledge and experience. They're putting me in Ayush. And when I went there, there was a very good advisor at Ayurveda who said, Madam, please don't read anything or listen to anyone. Just come with me. And he took me to Banaras Hindu University, the Institute of Medical Sciences. He took me to the Gujarat Ayurvedic University. He took me to the, you might say, the Pune has its own Tilak Mahavidyalaya, and several other institutions, the National Institute of Ayurveda. And he did not talk at all. He never tried to at all brainwash me, but I was surprised. Some of the things were so inspiring. To see a coolie who had a back injury, lifting obviously luggage, and he was going through the process of panchakarma, and I talked to him. I talked to all the patients. I said, why have you come here? On Gokul Ashtami Day, which is a very big festival in Maharashtra. It's all over the country, but of course in Maharashtra it is particularly special. On Gokul Ashtami Day, there were women sitting on a bench in Podar Ayurvedic College on Varli Sea Face. And I asked these women, in fact, what are you doing here? So they said, no, there's a clinic here, antenatal clinic going on for babies, because they were pregnant women. So I said, why have you come here? They said, no, because today was the date given to us and it's not a holiday, but we are. And I asked them, what do they do for you, for gynecology? And the things they told me made me understand that there are different ways which should not be scoffed at, but we are unable to blend them for the benefit of the public. Now, I would only go back to my, you might say, where I was leaving this, to say that how we can understand the blend, how can this blend be put forward, is what is really the point at issue. Now, when you come to the issue of strengthening the resilience of India's plural health systems and the lessons learned from COVID, because that is the topic given today. First, there was a spontaneous response, and we all know it was countrywide. It cut across all sections of society. This was seen as an Ayurveda initiative, and alongside homeopathy was also used and got a huge impetus. The demand for Ayurveda and homeopathy products increased manifold, which shows the kind of response. I'm not talking countrywide, but I'm talking for a substantial, you might say, area, which is Noida in Uttar Pradesh, but next to Delhi. A very vast, well-populated area, and the Hindustan Times reported that from this area, there was a 45% increase in the sales of honey, 45% sales of Chyawanprash, 85% sales of turmeric. A box of Giloy tablets, which sold at 100 rupees for 60 capsules, went up to 250 rupees, and people paid for that. And then finally, the Ayush ministry issued a protocol on the management of COVID through using the Ayurvedic system. So it got a kind of, you might say, a kind of a legitimacy which did not exist earlier. But the flip side is the quality of research which I have read about was inspiring if you listen to the rhetoric, but was not at all inspiring if you looked at the way it was done. For instance, if you take two sets of people and say, I gave a placebo to this lot, and I gave the Ayush medication to this lot, and this lot did not get into COVID complications, and the other lot did in larger numbers, then obviously Ayurveda works. I think that is a very, very simplistic way of going about it. And that is where problems will arise if one jumps on the bandwagon of that kind of research and say, we are effective, so take us on board and we can do things as well as you can. I think the better way of going about this would be the following. When I was doing this status report on Indian medicine, I questioned this whole thing. Why are people at all using these systems of medicine? There must be some knowledge on this. So they said, no, we don't have any research study. So we designed a study. We got hold of 1,000 patients from Ayurveda and 1,000 patients of Unani who were visiting the hospitals of the Central Council of Research in Ayurveda, which is separate from the Central Council of Research in Unani medicine. So the 1,000 patients were administered a questionnaire, and the results of what came out tells you exactly why the public is looking for something. And I wish TDU would really give a kind of, I would say, not just TDU, everybody involved in public health were able to give a structured way of answering the demands of consumers, which is completely different from answering the demands of lobbies. Lobbies will look after their own interests, but at the end of the day, it is the patient, the consumer, the family who matters. It does not matter whether all those lobbies got more money or whether the standards were taken up or taken down, if the consumer gets nothing out of it. And that has been my biggest complaint against the Ayush system, and COVID-19 is an excellent opportunity to branch out, not by claiming that I'm going to cure COVID, which a lot of the doctors did, unfortunately, or to say like in the past, oh, we can cure AIDS, we can cure cancer. That is what is, takes away from this system. On the other hand, if one is able to answer the questions which were put to these people, and I would request Sarin to please put up my 4 slides one after the other.
Sure, ma'am. I'm just sharing.
Remember, this was a study of 1,000 patients of Unani and Ayurveda, and it tells you what you may know or you may not know, but it's in my report, but I dug it out because it is relevant even today. The summary of the survey on the outcomes of relating to adjuvant treatment. Adjuvant means you're already on allopathy, but you also want to take either Ayurveda or Unani medicine. I didn't do it for homeopathy. So let's look at these figures. Now, if you look at the patients, you will see number 1 to 9. I don't propose to read everything, but it does give you a flavor of the allopathic drugs. According to some, the percentages are given, what people thought. The allopathic drugs have side effects, and Indian and Ayurveda Unani medicine are natural. This is one of the reasons. To avoid surgical procedures for things like stone in the bladder or something like that. To improve quality of life and mitigate symptoms. To get a second opinion that, all right, I've gone to every allopath, let me ask a Unani doctor, what does he think I have? The allopathic system of medicine does not suit the patient. Gas banta hai, mere ko chakkar aati hai, that kind of thing. The dosage of allopathic medicine can be reduced by taking Indian medicine. A lot of people feel, all right, I can reduce the quantity of metformin if I'm able to also take Ayurvedic medicine, which would bring it down. And of course, things like you can have kathal, that is jackfruit, put in your atta, which has now been proven to be an agent which can bring down your blood sugar. Those things cannot be denied to consumers. If they believe in it and are getting a relief, and you have a legal pluralistic system in the country, how can you put it down? Then you have to avoid expensive diagnostic procedures, to avoid injections as a mode of drug administration, and to avoid hospitalization. These were the main reasons, and the percentages for Ayurveda and Unani are given alongside. You can access it from my report, which is on the internet, or you can take this from Sarin after it's over. Okay, next. Remember, there were 1,000 patients, the numbers actually given there. And so, it's not such a small sample. And what we did was we went into whether they were married or unmarried. We went into their economic status. Were they above the poverty line? Were they the average kind of a person? We described average. below poverty line. And then that showed you that you went through a cross-section of the socioeconomic group. The sex ratio also, male and female, because you can't have all men and all women lumped together. And their educational status. Were they illiterate? Were they up to primary, high school, college and above? So the data was sort of put together in a comprehensive way using statisticians. Is that all? Hello? If that's all, we can take this off. We can take these slides off. Remove them, I think. Yeah. So this was just to give you a flavor that people are interested, and we need to somehow find a way of answering the consumer's need, not the protagonists of a system and their needs. And if one looks at the things which I saw in these hospitals, some of them were really, I mean, I really felt, I wish some of my people, you know, whom I knew as friends and colleagues in the health ministry saw this. Even things as simple, I mean, you may scoff at it, but I went to a place called Unnao in near Lucknow, 90 kilometers from Lucknow, part of my visit. And there you had this bone setter. He wasn't a tiny man under a tree. He had probably 1,000 splints in a Godrej almirah. And there are pictures of this man at work in my report. And he was attending to patients who came from most parts of, I mean, surrounding areas of Lucknow and Unnao. And he was dealing with fractures where people did not want to go in for any kind of surgery or any fixator or any traction for any reason. I saw a young woman there, probably about 22 years old, 23. And I said, what are you doing over here? She seemed to be, you know, sort of educated, talking well. She says, look, I have a rheumatic heart or something. And she says, I cannot afford to be lying down like this forever. But they put these splints and make me walk from day 2. And I'm able to get back on my feet. And my mother cooks food for me right here. And I'm not in a hospital, I'm in a community. So these are things which can be done. And I don't think they should be scoffed at. What we really need at the end of the day is to have a process whereby, because of the tremendous importance that has been given to the Ayush systems, the great belief that has returned to Indian homes and Indian families, find a way of bridging the gap that exists at the consumer level, but also do not judge systems by a lens which is inapplicable to those systems. Yes, if we could, ideally what I would have liked to see, and I wish if I had a magic wand, I would do it. If you had family practitioners from the Ayush system, and they have been permitted by various state governments to use allopathic medicine, and they're doing it anyhow, that they should not be doing it, that they should stick to their own system. I am a purist at heart. I feel that Ayurveda was meant to be done with a mortar and a pestle, and you were supposed to be given custom-made medicine. You were not supposed to be bunging in pills, and therefore to ape allopathy is wrong. But since we have reached a stage where you cannot put the clock back now, there are just no takers for the purist and the Shuddha Ayurveda. Let us make the most of what we have. Once again, I qualify, I am a purist at heart. I do not believe in cross-pathy. But having reached that far, can the family medicine doctor be covered through an insurance scheme which says, just like you buy car insurance, where you say, okay, you're Ayush, you will look after this family as the family doctor, and for every 5 years that you're able to see that the family does not get into, family meaning, of course, I'm talking more about people in the plus 35, 40 age group, they do not get into the NCDs, the chakkar of non-communicable diseases, by helping them to overcome tremendous, you might say, eating of salt, sugar, no exercise, irregular habits, all the things that Ayurveda teaches you to do differently. And definitely, much as I give credit to Dr. Reddy for my mother's living to be 102 and a half, a lot of it is because she also kept to the Ayurvedic principles of healthy living. So anyway, coming back, if this doctor were told, you will be paid for every year that you keep a family out of that kind of mess. Of course, you will have to have preconditions of who is eligible to be covered. And he gets paid by them, by the company, not by the family. But the family pays that kind of insurance, so they get their return on that investment. I think that he would be able to bring the blend. He would show you how that kadha is made. He would tell you that you don't need to have anything. You'll be fine in 2 days if you just stick to this. This is a virus. You don't really need to be going into antibiotics and things like that. He should be able to do that. If that were done, and he had a cluster of families, much like the NHS system, I think Ayush would get a completely new way of being recognized. And the time is now when Ayush is very much, including yoga, is very much in the public eye. It is being used, you might say, universally. I think there's nobody whom I met means talk to on the telephone or occasionally met with the mask on, who said, "Acha, aap kya le rahe hain?"
Apologies for the interruption. It's 11:40. Just letting you know.
Yeah, I think I'm ending now. I just want to round up by saying thank you for inviting me. Thank you for listening to this bit of a fairy story, you must be thinking. But I am a hard-boiled administrator. And when I tell you these things, they're not out of passion. They're not out of rhetoric. That is purely out of common sense. I think this has been a great opportunity. Thank you for inviting me. It's been wonderful talking to you. Thank you.
Dr. Reddy and Dr. Shailaja Chandra and Professor Abraham for a 10-minute extension. And I will just raise 4 synthesis questions that have come up in chat. I'm not going to take individual questions, but I've tried to summarize them into 4 different themes. I'll tell all of them, and I really leave it to you to pick up any of the 4 and share your final remarks. And I hope that's okay, Dr. Reddy and Dr. Shailaja Chandra and Professor Leena Abraham. We promise to relieve you at 12:40. Okay, so first point that comes is about what kind of institutional arrangements for a more integrated, comprehensive primary health care are really possible, what are available, what would be your thoughts on this? And some interesting comments on the chat on how family medicine practitioners in the private sector, for example, have been innovating in creating more interprofessional care, bringing together multiple streams of health workers together, etc. But how do we really, what kind of institutional arrangements for the mainstream health systems come to your minds? Second one is a different theme. It's on the fact that commercialization and corporatization of healthcare is not limited only to modern systems of medicine. It is also happening with Ayurveda and various other systems of medicine. And these also seem to have implications on the kind of research methods and the kind of marketization pressures that traditional medicine and Ayurveda need to start conforming to, which may not be in line with their systems of knowledge production. So what thoughts on how this can be addressed, or what are your thoughts either academically or in terms of regulatory fashion? What thoughts come to your mind on marketization and corporatization of healthcare and health research in general? Third one is, of course, many speakers talked about and many participants bring up the role of traditional medicine. The fact that there are various medicine practices, healthcare practices, wellness practices that are not necessarily codified and formalized. What future for those? Because they are not inherently marketable or corporatizable. So what future do you see for that? And finally, any thoughts, remarks for early career researchers or doctors or health workers in the audience? What would you say to these 2 audiences, doctors or researchers, who are interested in this topic of integration and mainstreaming? With that, I pass back to the speakers in the same order. So Shailaja Chandra ji first, and then Dr. Reddy and Dr. Leena.
You put so many questions, I don't know how to answer them.
Any of them. I know it's difficult to answer all. Any one of them which speaks to you, please pick one of them.
Well, I would say that we are talking a lot about primary, and I'm using the opportunity you've given me to cover something which I thought was really very impressive. And many of you may have heard of it, and I don't see why it cannot be practiced by more hospitals. It's not just primary. In the hospital setting of Medand in Gurgaon, you have an Ayurvedic practitioner. He's now in WHO and has been replaced by somebody else, Dr. Geeta Krishnan, uh, where if you have had a robotic surgery, you may say that it is not going to be painful, but it is hugely painful. I'm told it's worse than having labor pain. Now that was handled by by the Ayurvedic system of doing this Katibasti. The person who was on chemotherapy, I remember Tejinder Kataria of PGI Chandigarh told me, she says, you know, we laugh that now this person is going to knock off 12 kilos because chemotherapy has started. But because of the Ayurvedic intervention, the metabolism went fine. There was minimal loss of weight. The appetite remained in order. And Dr. Geeta Krishnan's Ayurvedic work was on exactly the same floor where high-end work was being done of cardiology. So he was not given some sort of a basement room or something. This sort of collaboration was done because of the leadership of Dr. Trehan, who, I mean, I'm not holding a brief for Dr. Trehan, but he had the vision to think of this kind of collaboration. Now that can happen, not if it can happen at tertiary levels, it can very well happen even at the secondary hospital and certainly at the primary health end, but not in the government system of planting somebody and telling that person, now you do your Ayush, but I have no medicine to give you. The drugs have been indented, they have not come. You have to make it easy for the consumer to be able to access both. And as Dr. Reddy said, and I'm completely with him on this, if there were a way of exposing these doctors, not to the mythology and the whole history and the concepts, the three doshas and all, to these allopathic doctors, they will not listen. Don't even attempt it. But if you took them to see for themselves how public is accessing systems in somewhat specialized Ayurvedic Unani places, then they would appreciate that, yes, I can do a referral. And the referral can be so couched in language, which is ethically correct. You're not giving a referral to a person. You're saying that this might respond to Panchakarma, and these are the facilities you could visit. I think that is the kind of integration that I would like to see, not just at the tertiary level, but definitely at the primary level. And this is workable. My only last thoughts are that we talk so much, but we don't want to invest in thinking of 3 or 4 examples which are working or which could work with minds which are able to think alike and put them across. Even a few examples of success would be a trigger, rather than waiting conceptually for the great, grand, you might say, magnum opus to be put in place and some sort of, you might say, treatise on the subject. I don't think we have the time for that, and nor does the public have the time to listen for the outcome of that.